My name is Parag Kachalia, and today we will be discussing how dramatic advancements in Caries Diagnostic technology can benefit both you and your patients. Visual and tactile detection has been the primary diagnostic modality for practitioners around the world, and I think most of us can agree that teeth number 31 appears to be carious. On the other hand, the state of teeth number 29 and 30 are not as clear. Adrian Lucie in 1994 demonstrated that explorers missed a substantial amount of decay. Yet for many of us, this is our go-to comfort instrument. This is simply how we were trained. Luckily, we tend to have few false positives, so we find the bigger issues. However, we miss decay at the early stages. The ICDAS system was created to help structure a visual assessment process that looks for key indicators. I do think it is better than traditional methods. However, it still leaves a fair amount of room for subjectivity, and the confusion tends to occur on teeth that look like scores 2 and 3. Over the last couple of years, we have seen a dramatic evolution of caries diagnostic technologies, and we have gone from a point-type device that provided an audible tone and numeric readout for the doctor to an imaging device that truly allows the patient to also be educated about their health. The Spectra technology is like Doppler radar and Google Maps put together. It demonstrates to the clinician and the patient areas of health and concern and provides a roadmap for conservative caries removal. The basic principle of Spectra detection unit is that blue light is emitted onto the tooth surface. The blue light excites porphyrins, which are byproducts of strep mutans, the primary caries-causing bacteria. These porphyrins cause a red fluorescent signal. Sound enamel causes a green fluorescence. The fluorescence light is then evaluated with Spectra software, and an analysis of the tooth surface is provided. This color scale really describes what is occurring, and this is the key for patient acceptance. Patients understand that health is represented by green and is not represented by red, yellow, or orange. This series of images clearly shows how conservative care can be implemented with Spectra. This 16-year-old kid presented for a hygiene appointment, and after a hygienist completed her routine Spectra scanning, she informed me about the fluorescence of tooth number 4. We discussed options with the child's mother and decided to do a conservative direct restoration at the same appointment without any anesthesia. In roughly 10 minutes, we provided a conservative restoration under an isolate. This patient was happy, and the day's production was increased. In fact, over our initial 30 days of usage, we found our acceptance rate to increase 12% compared to standard intraoral images. In our relatively small practice, this has led to roughly $2,400 in extra production per month. Additionally, this technology has also allowed us to improve our recall systems for patients that tend not to schedule treatment as easily. Rather than sending a generic Snoopy recall postcard, we send them an email that shows them their tooth and gives them more of a sense of urgency because we stress conservative treatment versus more extensive treatment. In my humble opinion, caries diagnostic technology has entered a new world, and this technology is benefiting both the patient and your practice.